If you've had COVID and never quite felt like yourself again, I know a lot of people are still suffering from symptoms or just, I don't know, leftover things from COVID. So if that's you, then this webinar is going to be for you today. Maybe you've had fatigue that just won't go away. Maybe you heart palpitations, I don't know, chest tightness, lots of different things. Millions of people are dealing with the symptoms long after the infection is gone. And so today, Dr. Saunders is going to break down what's really happening, especially in the heart. So stay tuned and we're going to learn all about that. Before we get started, though, I want to remind you that this webinar is for educational purposes only, and it's not intended as medical advice. So please make sure you consult with your personal physician before you make any changes to your diet, your exercise, or supplement routine. All right, so Dr. Saunders, so many people have tell us that they've had COVID and maybe they recovered from the initial illness and they never quite felt like themselves again. What is going on there?
Okay. Um, even though we say we're not giving you medical advice, we're giving you marginal medical advice. And the point is it may not apply to you specifically. So let's look at that. Jody's question is a very good question. And there's nothing new about this. This has been going on for generations, hundreds, thousands of years. And anytime they have things written up on this, people get sick. And then after they're sick, they have persistent long-term illness that just does not go away. And most people, of course, whatever 80% of people completely recover, they're fine. They do no problem at all. But what about those other people that remain ill for long periods of time? And what's going on here? Why do 80% of people recover from Lyme disease and 20% of people are just persistently ill? Why do people with Epstein-Barr virus, like mononucleosis, most of them get better, and some of them are persistently ill? My son was 15 years old. We were in Mexico. He got Epstein-Barr virus. He was laying in the back seat of the car for the rest of the time we were in Mexico. We drove all the way through Mexico. And we got home, and for the next year, he was in bed, like barely got out of bed to go to the bathroom, did not come down to eat dinner. We forgot about him sometimes. Oh, did anybody feed Micah?
Poor
And
guy.
I know, right? But then he's getting better. He's actually working now and living on his own. He's doing great. But it's been years. It's been years of recovery. So why is that? Why does that happen? And COVID is no different. There's nothing magical about COVID. It's not, oh, long COVID is like different than Lyme or Epstein-Barr or any of these other ones we've been dealing with for hundreds of years. No, this is like it's a thing that happens. And dang it, I'm going to tell you my story, okay? Because my story is so unique that you should hear it. I was a medical director of a nursing home with 128 beds, so a fairly large size. And this is all long-term care nursing. Like these are people who are all sick, sick, sick. They have cancer and bad diabetes with neuropathy and their legs cut off, and these are not people who are just living there in board and care. They need 24-hour nurses, right? This is like bad news stuff. Well, COVID comes around. I'm the medical director, and they have, um, and it gets into our facility first. We're the first ones in Santa Barbara to get it. And we get 65 people positive, and they won't let us send anybody to the hospital. So we're out there one day, and all of the staff, we're clearing out a whole wing, moving everybody over, and we made a COVID unit. And so this is like everybody with COVID was in the same unit. they had to pay the nurses extra nurse pay, and they're in their jumpsuits with the respirators on and everything, working full time, right? Because all these people need full time care. They've got Alzheimer's and cancer and all kinds of junk that they're dealing with. So I put them all on vitamin D, high dose. Well, they're getting 50,000 units a day of vitamin D. I'm sorry, a week of vitamin D. Uh, they're getting ivermectin, and they're getting hydroxychloroquine. Okay, and this is the best we knew of back then. Um, and the doctors of these patients would not come in and see them. They're not going, I'm not going in any COVID unit, and they have like the negative pressure things you have to put your stuff on to walk into it with the poof and everything, and the airlocks, like as if you're going into space or something. And so they wouldn't go in. Doctors wouldn't go in there. Nope, nope, not going in there, not going in there. So guess who had to do it? The medical director, right?
Oh,
So I had
wow.
65 COVID patients to see every single day. And I didn't have the PPI, whatever that is,
Oh, right. The protective.
protective stuff and all that. I didn't have a respirator and all that stuff. So I was like the most exposed person in the world. 65 people positive for COVID every single day. I was exposed more than anyone else in the world. Nobody had more exposure than I did. Nobody. And
Mm.
guess what? I didn't get sick. I was
Oh,
fine.
wow.
You know why? I'm taking the I'm
Were you
taking
doing what you were
the
giving
vi
them?
the vitamin D, yeah, yeah. So I'm doing
Oh.
okay. So I was fine.
Did you keep it
Then
contained in there? I'm just curious.
oh yeah, we kept it contained in there.
Mm.
Nobody else outside of there got it. So we had another 60 people outside that never tested positive. They were testing them every day. They're having to, put the swabs up their nose, and I never tested positive. And we lost four, and we couldn't send
Wow.
anybody to the hospital. Isn't that amazing?
That
We
is amazing. And you were dealing with the elderly
el,
population. I
el,
Yep.
mean,
el,
Predisposed people, right?
elderly sick
yes.
people. Yeah, all elderly sick
Wow.
people. So we did lose four. One, well, all of them were pretty sick to begin with, of course.
Did they
So,
have any like, do you remember the four? Like, were they diabetic
um,
or cancer
Overweight
patients or,
or
yeah, did they have
uh,
any of those other?
um, well, I remember one because he had Alzheimer's.
Mhm,
Another one had cancer.
mhm.
Was a chronic lymphocytic leukemia, CLL.
Okay.
Um, yeah, and I don't remember the other two. I remember that they got really sick, and their lungs filled up with fluid, and they got really sick and they died. Anyway, so we did lose four, but that's amazing compared to all the hospitals in the United States. We did better than all of the hospitals in the United States, every single one.
Yes. And you weren't putting people
So,
on respirators and all those
right, we
crazy
didn't,
things.
yeah,
Yeah.
and it's probably because we didn't put people on respirators. So, so then after that, after everything is like almost cleared up, then they decide they're not going to let people into the facility anymore. That their families can't come and visit them anymore. And then they decide that the staff can't come to work unless they have the vaccine. So the vaccine comes around that because we had all of this going on before there was any vaccine. This is all way before that. So then I'm like torn between this. I know the vaccine's dumb, but finally I gave in. I said, okay, fine. So I took the one and done Johnson and Johnson vaccine, and I'm like, okay, I took a 50,000 units of vitamin D right before, and I took the ivermectin right before, and I'm like, okay, I'm not gonna get sick from this. Um, And then, so I got the vaccine and I didn't get sick from the vaccine. But since that time, every single time I've been exposed to COVID, I've gotten sick.
Yep.
And not just a little sick, really sick. Like you hear me coughing now.
Mm-hmm.
I'm getting over 3 weeks of coughing because I was exposed to COVID again.
Mm-hmm.
So this long COVID for me is not something that's hypothetical. This is like a real thing. When I got COVID the first time after I got the vaccine, I had brain fog. I had all the problems. I I was scheduled. Uh, they had asked me to do to give a speech at a funeral, and I'm laying there, I'm sitting trying to figure out how to write a speech, and you know me, I'm not at a loss for words. I can write speech. I could not think. I couldn't even
Mm-hmm.
do it. It was really, really hard. And so I've been through all of the brain fog, fatigue. I got cardiomyopathy. I got all my tests back, and they're terrible. My tests are terrible. It's like I'm an old man now all of a sudden. And my heart tests are really bad.
And that should
And
not be that way because you are a healthy eater and you
Right.
run and exercise
yeah, 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 yeah. And
Fast. Yeah.
and and I'm in and I'm in renal failure. And
Oh,
all because I got the vaccine and I've been sick now several times. Okay. So my story is significant. I was exposed more than anybody else, never got it. And then I took the vaccine and I got sick. And I've looked it up. And when you see what the reality of it is, let me
mm.
find it here. I want to show you. I hope everybody can see this.
Yeah. I can kind of.
Um, so this is a graph showing the number of vaccines, and the amount of illness that people are getting. So this is the number of vaccines. This is 0 vaccines, 1 vaccine, 2 vaccines, 3 vaccines, 3+ vaccines. And you can see the more vaccines equals more illness, period.
Are you talking
Uh,
COVID vaccines or
COVID
okay.
COVID vaccines,
Oh
the
my goodness.
more the
Really?
more COVID vaccines you get, the more COVID illness you get.
Oh,
Period.
that's
There
terrible.
was no that it never reached where you know there's usually an asymptotic curve. You get to a certain point and more vaccines doesn't make it worse. No, more vaccines always makes it worse. 10
Mhm.
vaccines is worse than 9 vaccines.
Mhm.
And so you're going to get more illness. And so why is that? There were some other studies done in Europe, and what they found is the more mRNA vaccines you have, the more IgG4 antibodies you get. IgG4 is telling your body, oh, that spike protein's okay. Go ahead and let it destroy your body. It's fine. It's not a problem. And so the immune system refuses to get rid of the spike protein because of that mRNA vaccine caused you to make IgG4 antibodies. And that's the same thing you're doing, for example, if you have bee sting allergies and you want to get IgG4 antibodies against bee stings so you don't get a reaction, so you don't cause a problem. Well, in the case of the COVID-19 spike protein, you want to cause a problem. You want to get rid of that dumb protein. You don't want it to be there. It's toxic. It does damage to your blood vessels. It damages your heart. Damaged my heart. So, so long COVID is a real thing in different ways than things like Lyme disease and Epstein-Barr and all those other things that have long-term illness associated with them. So there are protocols for getting rid of this. And it's not necessarily that it will be gone forever because you may be exposed to it again and you still have IgG4 antibodies, and so you're going to get another illness that you may have to deal with. But the FLCCC, which is now called the IMA, Independent Medical Alliance, um, has protocols on their website for what to do for this. Some of the thing, most of the things are over the counter things that you can deal with. The Some of them are prescription, but it does work, and it does help. Another thing that I have found personally is getting the mitochondria functioning again. So to get your brain fog away and get start your energy systems working again. So you got to exercise. If you don't exercise, then you're not going to get the energy back. And then number two, I've found something called ATP 360. Um, it's Integrative Therapeutics makes it, I found it to be it works really well. I mean, within 3 days, my brain fog was gone, and I was back to thinking clearly, which for
So
me
it's
is really important.
yes, is ATP 360, is that like a supplement? Is it a
Yeah,
what
Yeah,
is
it's
what
a
is that?
supplement. Yeah,
And
it's a
what's in
supplement.
what's in
Yeah.
it? What does
Um,
ATP stand for?
ATP is adenosine triphosphate, and that's the energy system in the body. And 360, I just assume it's like all the way
Full
around.
circle.
Yeah, yeah,
yeah.
yeah, you're getting. So what it does is it helps your body to make ATP from several different aspects. To make more mitochondria specifically, and then to provide the building blocks for making sure you can get the energy in the mitochondria.
Mm.
And you said so that, and then you said exercise can also help with the brain fog?
Exercise is really important. And L-carnitine
Mm.
is really good. And creatine.
Ah,
Uh, yeah, creatine. If you get creatine in fairly high doses, like 10 grams, and then exercise, it gets the energy, builds energy very nicely.
and are
Yeah.
those things you need to keep doing? Like once you've had this brain fog, if you get rid of it, do you feel like it goes away, or can it come back because you're kind of predisposed to this now?
I haven't found it come back
Good.
unless I get sick again. So,
Mm,
so if yeah, that's kind of the problem is getting sick
cycle.
again. Yeah.
Okay.
Mm.
Yeah.
So why do some people bounce back faster than others who've had long COVID?
Harvard did us. Thank you for that. That's an excellent question, and everybody had that question. It's like, what the heck? Why do some people like? Harvard took 65 young men that had cardiomyopathy from the vaccine, the COVID vaccine, and so they had long COVID from the vaccine. So people think you can only get long COVID from the illness, like you had to be really sick to get the illness. No, 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 no. You can get long COVID from the vaccine, and a lot of especially young men have a cardiomyopathy for that, and young women tend to get neuropathy, like autonomic nervous system dysfunction, like POTS syndrome, like they stand up and get dizzy, like their temperature goes wacky, like they have sleep issues. So for women, it's a little different. It's usually a neuropathy kind of problem. And for men, it's usually like a circulation or cardiomyopathy kind of problem. And so Harvard wanted to know why. They're like, what the heck? How come all these young men are dropping dead? All of the ones on in the football fields,
Yeah, the athletes. Yes.
yeah.
Healthy people.
Why are they dropping dead from cardiomyopathy? Because they got the vaccine. And so they tested it. And so they took a bunch, like 50 young men that had cardiomyopathy from the vaccine, and they clearly, showed that, their troponin levels were high and all that stuff. And then they got another cohort, the same number that had the vaccine that did not get cardiomyopathy, and they were just sure that they were going to have like high testosterone levels or something because why young men, the testosterone levels are high. Nope, that wasn't it. It wasn't testosterone. It wasn't hormones. It wasn't inflammation. It wasn't diabetes. It wasn't, none of those issues showed up. Only one thing showed up, and that was the persistent circulating spike protein. That's it. That because they had the vaccine, their mRNA was making more spike protein. And the ones that didn't get cardiomyopathy, they cleared it quickly. So your question, why, is some people, most people, probably 80% of people clear it quickly. It's gone, like in minutes. And the ones that don't, that had 6 weeks, 6 months out, they still have circulating spike protein. Spike protein is toxic. It's dangerous. It damages the lining of your arteries. It's not a small thing. It's a problem. And these kids had a ton, and it was persistently circulating for a long period of time. So that was the only difference. That's it.
So when,
So,
oh,
oh,
I
so
was
they
like,
got rid of the spike protein, but how?
yeah, I was
What
gonna
was
say,
their
how do you
lab?
clear it? How do you get that
How they clear?
cleared?
Yeah.
Their immune system worked,
Well,
cleared
like
it
the
out like
immune
it's supposed
system.
to. Whereas if you get an injection and you make IgG4 antibodies, you're not going to clear it out. If you make IgG2 antibodies, you're going to clear it out. So
Mm,
that's the difference.
Hmm.
okay. Okay, interesting. So, okay, so we may have viewers who had the vaccine. What are some of the other symptoms, like for them to know maybe they're dealing with long COVID? What other symptoms? So we've talked about
Oh,
you like you
there's
get
a
sick.
whole
Okay, yeah, give us some of the top symptoms. What are we talking
Okay,
about?
so fatigue and exertional problems are fairly common. I had a young man. He was so mad. He says, "I'm not getting the vaccine," and his parents said, "Well, then you can't come home if you don't get the vaccine." So he said, "Fine." He went and got the vaccine, and he got cardiomyopathy, and so this is a big one: is post-exertional fatigue. He wanted to go out surfing, and he, brings the surfboard, and he walking across the sand. He can't even get to the water. He can't walk across the sand. He can't even get there. He's so fatigued by the time he gets there. He couldn't even walk back. He had to sit there for a long time. And so this post-exertional fatigue and the profound crushing fatigue. So you sleep and you wake up fatigued, that kind of thing, and exercise intolerance. So those are common ones. And then there's the neurological problems. When I've been telling you, you have brain fog, you have the sympathetic and parasympathetic nervous system, the autonomic nervous system dysfunction, where you stand up and you get dizzy. You feel like you're dehydrated all the time. Your stomach you have stomach issues, and sleep disturbances. You don't sleep right, and then neuropathy generally, a tingling, numbness in extremities. And then there's the cardiovascular, the palpitations of the heart, respiratory problems. You feel like like there's nothing wrong with your lungs, but you feel like you can't get enough air. That's kind of a problem. Autonomic nervous system dysfunction. And then some people get joint and muscle pains, like they just joint, but it's connective tissue problems. So it's not like arthritis where their joints are swollen. It's just stiffness and pain. And then the connective tissue is painful. And that's a common thing too. Hair loss. Oh, I had a lot of young women, the nurses in the nursing home, after they were getting the vaccine, they were complaining of menstrual irregularities, because the when they inject you with, they're called lipid nanoparticles. And their lipid means fat. So they're little fat globules that have the mRNA inside them. And those fat globules go to certain areas of the body. And what's really weird is they just love ovaries. It's kind of funny, not testicles, ovaries specifically. And why that is, nobody really knows. But when tests were done in Japan about where the lipid nanoparticles go, ovaries was one of them. And so that's why women had a lot of menstrual irregularities and hormone imbalances and stuff like that.
Oh my goodness.
So,
So
so
sad.
well, so you can see that it's like all over the map, musculoskeletal, it's your cardiovascular system, it's your nervous system, it's all the systems.
It's a mess, is what it
It's
is.
a mess. It's a
It's a mess.
mess.
Okay, so you talk about the heart, and for people who may have had heart palpitations or other heart-related issues from the COVID or the vaccines, what's actually happening to the heart?
The spike protein damages the small arteries of the heart. So the large arteries look okay. So if you were to do an angiogram of some kind of the heart, it would look okay. But then you would wonder, well, why is the troponin level high, which means the cells are dying? Why are they dying? Because the same reason why you have a heart attack. They're not getting enough oxygen. Why not? Because the tiny vessels that you can't see are clogged up and damaged from the spike protein.
Hmm. Is that what you would consider cardiomyopathy then?
Yep, that's
Okay.
cardiomyopathy, myocarditis.
Okay.
Yeah.
Tell, what are some of the symptoms, especially, heart related, when you should go see the doctor? Like
Oh,
what's serious
well,
versus just uncomfortable?
yeah. Palpitations are uncomfortable, but crushing chest pain, that's serious. If you can't breathe and you have crushing chest pain, you just got to find out what it is. Unfortunately, if that's the problem, there's really nothing that they do about it.
Well, I
Not
was just
nothing
like,
that they can, not nothing
yeah,
that they can do, because
right.
then you have to go to the FLCCC website, the IMA
Mhm.
website, and get the protocol on dealing with long COVID.
That's what I was going to ask is, I mean, how many doctors, if people are coming in with these symptoms, are really looking at, oh, it's related to the vaccine, long COVID, or are they isolating these, oh, this is just something else, because if your doctor isn't identifying it, then you're not going to get the protocol you need.
Exactly. And that's always been the issue. I mean, think about Lyme disease.
Right.
For for years, I was practicing medicine for 30 years before doctors even recognized Lyme disease existed. I mean, they were saying, okay, in order to have Lyme disease, you have to have been in Lyme, Connecticut, bitten by a tick, and had a target lesion rash. If you didn't have all of those, then you could never have Lyme disease. And of course, that's totally ridiculous. And now everybody's going, oh, well, actually, Lyme disease is in California too. Oh, yeah, it's in Texas too. And so they're just starting after decades to recognize Lyme disease. Now, think about that where we are with COVID right now. Yeah, Harvard did the study, but what happened? Well, they just buried it. Nobody even looks at it. If you
Well,
ask,
yeah.
if you ask any infectious disease specialist, ask them about the Harvard study on post-vaccine cardiomyopathy, and they'll go, "I've never heard of that," because
Mm-hmm.
they have never heard of that. They don't know anything about it.
Mm-hmm.
Yeah, you mentioned the ovaries earlier, and now we're hearing in the news that a certain doctor, I don't know if I should say his name, but he was worried about it affecting for miscarriages.
Yeah.
Is that true?
It's entirely possible, and there's good evidence for that, but it's buried also.
Mhm. So what are the other doctors of research? How are they starting to approach this? What are they finding? What are they studying, exploring as solutions or reasons or causes?
Well, um, the causes are first of all avoid the vaccine for
Mm.
heaven's sakes. I mean that's where every vaccine increases your risk of COVID by that much, and then the more you get COVID, the more likely you are to get long COVID, and so. you're better off avoiding that entirely. And so then the other things that they're finding are, oh, when people do get long COVID, there are there are things that we can do to at least slow it down, ameliorate, or even reverse it.
I've seen that ad on TV. Oh, wow, and I hate those ads on TVs for things that you can ask for. But they're really pushing the if you think you have COVID now, it's kind of like they used to do for influenza. If you took the Tamiflu right away within so many days, you could cut it down, whatever, whatever. There's something that they're offering for COVID now that's supposed to like stop it, shorten it, whatever. You know what I'm talking about?
Remdesivir,
Maybe.
it's
And do those work, or should we steer clear of those as well? Do we just, if you get COVID, you just need to push through, or I mean,
yeah,
obviously the ivermectin and the vitamin
yeah,
C is
yeah,
good.
yeah, definitely go the more natural route and avoid those. Yeah,
Hmm.
yeah, avoid the pharmaceuticals.
Yeah, if there's an ad for it on TV, chances are you don't want to put it in your body.
Yeah.
So what about if we do have folks who are dealing with, the symptoms, what can they do, to support their heart, to support their recovery? Are there any natural like nutrients or supplements or anything that, can help, or what can they do?
Um, well, I would just uh, go on the IMA, the Independent Medical Alliance website, or FLCCC. Um, they have protocols that have been tested and are well known, and just do the protocols because that's what you got to do.
I was going to try to find that website, Jody, while you guys are
Oh,
talking.
okay. Okay. So we have Lori is asking in the Q&A, could a woman have, is it Raynaud's disease from the COVID
Yes.
vaccine? You know anything about
Yeah.
that?
Well, from the vaccine, from the illness, yes, because the damage is done to the vasculature, and the Raynaud's is a constriction of blood vessels. Um, and the other part is that women tend to get more of the autonomic nervous system dysfunctions than men do, and men tend to get more of the heart cardiac problems. And so, especially in a woman, something like Raynaud's, which is an autonomic nervous system dysfunction, could happen, yeah, easily because of that. That would be a trigger or a reason for having it.
Okay. Mary wants to know, do all mRNA vaccines increase the risk of getting sick? I think I heard on the news that they're coming out with an mRNA flu vaccine.
Yeah, so it seems like, and the problem is that the actual studies that need to be done are not being done. But it seems like all of the mRNA vaccines do the same thing, and that is about 20% of people are going to get IgG4 antibodies and get tolerance to it and get sicker because of it. So yeah, 80% tolerated okay and make antibodies, IgG2 antibodies and like they're supposed to, and everything looks good. But but the yeah, I would be very wary unless something is fully tested. And it's they're just like the companies that make these, they don't want to do any testing. Unless you can see that, okay, this has been tested in a million people and nobody made IgG4 antibodies, then you go, okay, maybe that's a reasonable one.
So Elaine asks, did you find that blood type made a difference whether you got COVID or not?
No, I didn't. That's interesting, though. That's an interesting question. And it may have something to do with why some people make IgG4 antibodies versus IgG1, IgG2, IgG3. So yeah, not specifically blood type, but the type of genetics that you have based on your ancestry, which would include blood type.
Hmm, interesting.
Okay, Lori had a follow-up about the Raynaud's. How can her sister treat it at this point?
The treatment for Raynaud's is treating the autonomic nervous system. So there are a lot of treatments out there that are available for autonomic dysfunction. Um,
Any supplements at all that would help?
Not specifically.
Okay.
There's, I have people do all kinds of things. There's magnetic treatments. There's therapies of various kinds. I've had people do even sometimes the Wim Hof method, where they do the cold plunges and the breathing, which retrains the autonomic nervous system. Yeah, it can be fixed. It's a matter of finding the right modality.
Okay, some anonymous says, I had COVID years ago with no noticeable side effects afterwards. Now I don't seem to be able to come out of severe fatigue. Could that be?
That's the hardest one because what happens is you damage the mitochondria that are making the energy for you. And so, you think you can have, oh, if I just eat enough sugar, if I just eat enough fat, if I just get enough protein, then I'll have enough energy. But unfortunately, all of that fat and protein and sugar has to be converted to ATP through the mitochondria. And the problem is the conversion to get to ATP, which is your actual source of energy. And so building that it's a big effort and it requires a lot of training. And so with the severe fatigue, you got to start slow and you got to just do what you can. And this has been true with, Epstein-Barr for generations of people have been dealing with this same thing because that does the same thing, destroys your ability to make energy. So you increase it gradually. And then you take the supplements for building mitochondria, and then you exercise increasing just very gradually, just one step a day, one step a day, one step a day increase. That's all. You don't push it and kill yourself because that doesn't build mitochondria.
Have you noticed that with yourself, Dr. Saunders, like with your running, or
Yeah,
have you? Yeah.
yeah, yeah. I was getting up to doing a 5K in under 30 minutes, and I can't even do 45 minutes now. Yeah.
Mm, that's
So,
frustrating. I'm sorry.
yeah.
All right, Mary wants to know, can a person be tested to see if they have the IgG4 antibodies present? Do they eventually die off and then stay away, or do they return with the next immune challenge?
Yeah, that's a great question. And so I've asked about, of course, for myself personally, I've asked about all these tests. And I'm like, well, if Harvard can test for spike protein, then I want a spike protein test. I want to see if I have spike protein. Nope, nope. So for political reasons, they won't allow it. IgG4, they don't have a test that's specific to the spike protein for IgG4, so it's not helpful. If you do an IgG4 test, you just get all the different types of immunoglobulin, IgG 1, 2, 3, 4, and how much you have generally, and that doesn't really help you with it. So the answer to your question is, can I test? The answer is no, and it's really unfortunate because the ability is out there, but for political reasons, they don't allow it to happen.
Do we know if they eventually die off and stay away and then come back if you have another immune, or we don't know because we don't
We don't,
test?
yeah, we don't know.
Interesting. All right.
Well,
That's very frustrating.
we do have a political question that just came in as well, since you're mentioning it.
Politics.
Yeah, interesting. Is this why JFK Jr. is fighting Big Pharma and trying to convict Fauci?
I don't know. A lot of that's political stuff too. And so, you know, there's so much that has a purpose in dividing and separating people. And so you have the people that really believe Fauci was a great man and really helped a lot of people. And then you have the people that think he's the devil and killed a bunch of people. And so part of that political rhetoric is to divide the population. So I think that that should be that kind of stuff should be put aside, and we should say, okay, how are we going to help people now? How can we benefit people? Because we have the technology, we could do this stuff.
Agreed. Agreed. Okay, Debbie has an interesting comment, and I want to know if you've heard about this either. She says, at this point, I think I've heard that mRNA is being placed in all vaccines and even being placed in our food supply, especially meat. Have you heard anything about that?
I've
I
heard
really
it.
hope Debbie's wrong.
Well, I don't believe it. The mRNA, it doesn't last in the environment very well. It's something that breaks down quickly. It's not something that is going to I don't know. It's not something you're going to eat and get incorporated into your DNA, for example. So I don't suspect that that's a real thing.
How about in all the vaccines or many vaccines?
Now, see, that's an issue because the assumption is that a vaccine contains what it says it does, and then, but then when they start testing for other things, they go, "Oh yeah, it also has this DNA, and it also has that, and it also has, green monkey cancer's DNA in it, green monkey kidney cancer DNA." How did that get in there? Well, that's where they originally grew it. So,
Yeah.
so then they in the green monkey kidney cancer cells. So, uh, you know, so there's all this junk in vaccines that people just don't take into account. They go, "Oh, it's a tiny amount. It probably doesn't matter."
Mhm.
Who
Yeah,
knows?
I also wonder, yeah, you wonder about that labeling because I know a lot of moms that, really want to know for their children what is in that vaccine. And there is so much pushback
Yeah, and you
on
don't
these
know.
women for even being able to see, which is
Yeah,
terrible. We have the right to know what's going in our bodies.
yeah. I agree. I agree.
And the right to
But
refuse.
yeah. Yeah. Well, what's really interesting is the pharmacists, the doctors, the pharmacies, the people that are administering the vaccines, they have no clue what's in the vaccine. They don't even know.
Nope.
So if you were to ask them, they'd say, "I don't know. Here, try it."
You've also talked about you've talked about the importance of mitochondria and this recovery. And I think I've heard in the past you talk about you can build mitochondria through fasting. Is that a good approach?
Yes. Yes. I think that's a really important part because you get what's called mitophagy, where you take all the damaged mitochondria and your body like eats them up and rebuilds good mitochondria from the ones that are not functioning properly. So yeah, fasting is like a really a really important way of rebuilding mitochondria and getting the energy back.
So if someone who has brain fog should do that?
Absolutely. Brain fog, fatigue, people who are fatigued, can't sleep at night. Yeah, all of that stuff. Fasting is a really good way to repair the mitochondria.
So we have a question. How does one build mitochondria in the eye, especially in the retina?
Oh, that's such a good question. So, if you've ever heard of macular degeneration, and glaucoma, these are problems with mitochondria in the eye. And the eyeballs are using mitochondria like crazy. These mitochondria are just, they have to have so many of them, and they're just pumping out ATP as fast as they can to get the energy so that you can see constantly. And then they have to repair at night when your eyes are closed and you're not looking at things. There's a lot of this cleanup and repair going on. And if that doesn't happen very well, if you're not cleaning up and repairing, if you don't have enough antioxidants, vitamin A, carotenoids, astaxanthin, zeaxanthin, all of those antioxidants, then what happens is you damage the mitochondria over time. And so you're getting less and less. And then your eyes just aren't working well. They're not going to work well because they don't have enough energy. So you want to build those mitochondria, and you do it in the same way. You exercise, you fast, you get enough of the nutrients. And I like the one ATP 360 because I've used it for years. I've had other people use it for years. It seems to work in the sense of it actually helps people improve the energy. Um, Let's see. And then getting a lot of antioxidants, like a lot. You can get, there's something called an REDS2 supplement. We call it Eagle Eye. And the Eagle Eye is really good. And if you have something like macular degeneration, I would double up on that. It's a really good supplement.
I do love our eagle eye. We'll drop it in the chat. Cheryl, will you drop that in the chat
Sure
along with
will.
our discount code so our viewers can save 25% on eagle eye? Okay, so Dr. Saunders, I also want to make sure we drop in the chat too. So you had talked about the protocol that you were using for the COVID patients in the nursing home. Tell us if we come down with COVID now, what do we need to take? So what are you doing when you get COVID?
Uh,
What can we do? What can we get our
um,
hands on?
well, California, this is the weirdest thing in the world. Yeah, California is such a weird place. I can prescribe any kind of toxic medication that could kill you. And if it does kill you, they go, oh, well, it's a complicated, it's a side effect of the medication. It happens, people die.
Mhm.
Oh, well,
Oops.
big
Yeah.
deal. Oops, whatever. And I can prescribe those. I have a license. I can prescribe those and anything. But a medication that has never killed anyone, that has billions of doses, that is over the counter everywhere in the world, is restricted. I can't prescribe it for COVID.
That
Um,
makes no sense. You
it's
can get them all
against
strung out on, addictive painkillers.
it's against the law in California.
Ugh.
So the legislature in Idaho was really intelligent because they could see the writing on the wall, and that all of these medical boards are controlled by drug companies, and they're preventing people from using ivermectin. So in Idaho, it's over the counter. You can just walk into any pharmacy and pick it up, and you don't need a prescription. You can get as much as you want
Oh
and
my
take as
goodness.
much as you want. So, so if you need ivermectin, go to Idaho.
Yeah, or contact someone. Yes.
Contact someone you know in Idaho and have them ship it to you. If your state isn't so intelligent. Um,
What else?
anyway, so besides that, there's N-acetylcysteine, NAC.
Oh,
Um,
yes, NAC. Okay.
NAC would be 600 milligrams twice a day. And I also take something called Nervala. which is benfotiamine and alpha lipoic acid, because that is a really good way to prevent neuropathy and nerve damage.
How much of the
Um,
Nervala would you suggest if they have COVID?
if you have COVID, twice a day, twice a day.
Okay. Okay. And any of the, was it vitamin C or D? Do we anything?
Yeah, vitamin D. Yeah, but I'm always taking vitamin D. I don't add extra of that. I tested my vitamin D level last week and it was 75. So it's not bad. It should be between 50 and 100. So
Okay.
it's right in there.
So how much of the vitamin D would you recommend?
Um, Vitamin D, 5,000 a day. So if you're doing synochroma has vitamin D 5,000 a day.
Okay.
See, that's the thing about the supplements that we have, the Eagle Eye Vision, the Nervala, the Synachroma. These aren't fairy dusting. You have you buy the
Yeah.
supplement and it has this list of vitamins this long, and
Mm.
there's like 2 pages and it's written this small. You have to put 3+ lenses on just to see it. And it'll say it has 20% of this and 9% of that and 12% of that, and it's like we call that fairy dusting. That's not useful.
No.
So our supplements are full on, full dose. You take one synochroma, that's 5,000 units of vitamin D a day. You're getting the full physiologic dose in one capsule. And Nervala, same kind of thing. You're getting the full physiologic dose in one capsule, and the only reason I double up is when I'm sick. I double up.
Okay. Okay.
And I did put a link to Nervala in the chat, as well as Dr. Saunders wrote an article about NAC. I dropped that one in the chat as well. And then
Okay.
before we go, he also has an article on COVID he wrote. I'll put in the chat.
Mhm. Excellent. Good stuff here. All right. So, Dr. Saunders, I know this has been a struggle for you. What's something hopeful that you can tell somebody who's feeling, like they've been
Hmm.
drugged down by this COVID thing as well? Give us
You know
some
what?
hope here.
Okay, it gets better. Yes, it's hard. It's hard to get through it. It causes fatigue, and some people are worse than others. Some people are in pain all the time. And these post-viral syndromes have been around for, forever. And if you don't do anything, then nothing happens. But we have ways today. You can get better. And so you just work on it and work on it. I had somebody, a young man, got a tick bite when he was like 4 or 5 years old. By the time he was in high school, they sent him to what's called home hospice,
Mm.
and they were sending a nurse teacher to his home because they just sent him home to die. There's nothing we can do for you. And now he's finished college. He's got a degree. He's doing better because instead of just waiting, we started doing stuff, and his parents started doing stuff, and we did ton of stuff, and he's better. And so that's like a dramatic case, but you know what? People with all kinds of cases, they get better. I see them get better.
Hmm.
I've gotten better.
Yeah. Yeah. One day at a time.
Yeah,
Like you said, little small steps.
yeah.
Sometimes that's all you can do.
Someone posted that they use Nervala every day and it works. They just want to learn, they're learning about B12. Does that also help with numbness in feet? B12.
Sometimes it does. Sometimes adding a shot of B12 can wake up a nerve. And I've seen that happen with people that have like post-herpetic neuralgia from shingles. I've seen that happen with that kind of thing. I've seen it happen with people who've had other kinds of neuropathies where a shot of B12 kind of wakes up a nerve.
Okay, great, thanks.
All right. Well, thank you so much for your time today, Dr. Saunders. We appreciate all the information. I know you need to get back to your patients. We'll see you next week.
Okay, see you then.
Thanks.
Bye.
All right. Well, Cheryl, wow, that was a lot.
It was. I was taking notes. I think you were too.
I was too. I was too. I'm anxious to look at the IMA or the FLCCC. Did you? I think you
I
shared,
did post that. Yep.
yeah, those in there.
I also found the link for the supplement he was talking about, the
Oh, the
ATP
ATP. Oh,
360. I'm going to
mm-hmm.
put that in the chat as well. It's not one of our supplements, but if it works,
Yes.
we want to share it.
And we don't have an NAC.
No, we don't.
But I think that one's a pretty basic. I think that
And
one's
I
pretty easy to get your hands on.
and I want to say that maybe one of our supplements had it, and then we had
I
it.
think it did, but I
Yeah,
think Amazon or something, there was some,
yeah, we
I don't
could.
remember what was going on with that. Yeah, it might have been in our Niagara, maybe.
Mhm,
We took it
mhm.
out. Yeah. Okay. Well, oh my goodness, so many great things yeah, so we dropped lots and lots of links in there. I know I've had some people asking what is our episode number because they want to rewatch. So today is episode 339, and I will email that out to everybody who is on my replay list. If you want to be on that list, just shoot me an email, webinar@bartonpublishing.com, and I will be happy to do that. And let's see, Bob is asking, has Dr. Saunders tried? Oh, Moon tea? I do not know. I do not know. We will send that his way. I know he has been under the weather, but I think he is on the mend for sure. But interesting story. But it's also gives me hope too. It gives me hope because there are things we can do.
That's how we ended. Yep. You got to
Mhm.
take action, do something.
Absolutely, absolutely. All right. Well, we will be back here next week with another topic. Same time, same place, but different topic. And we hope that you'll be able to join us. I did drop the link to our YouTube channel out there. If you ever want to go back and rewatch, that's where our replays live. You can search for any past episodes there. Also, I dropped the link to the Facebook community if you want to see what are we going to be talking about this week. You can check out that out there as well and join the conversation. We love to see you out there as well. So thank you so much, everyone, for your kind words. And we thank you so much for being here. And we look forward to seeing you next week.
We do come back and let's chat again next week.
Yes, absolutely. All right.